Good afternoon, everyone. Can everyone hear me? Yes?
Yes.
Okay, great. I'm so pleased you could join us today to discuss the important contribution of immigrants to our nation's response to and recovery from the COVID-19 crisis. Immigrants are playing a central role on the front lines in this fight as doctors, nurses, agricultural workers, home care workers, educators, and researchers. This is particularly true in my home state of New York, where nearly 30% of nurses in New York and New Jersey are immigrants. The COVID-19 pandemic has shaken our healthcare system, our economy, and our society as a whole. And while we are all working together to protect our loved ones and our communities, the president has continued to push a divisive message. Despite the fact that America is relying on immigrants in this crisis, the administration has announced a new immigration ban, has refused to ease restrictions on visa holders, and engaged in constant fear mongering about immigrants. And while hundreds of thousands of DACA recipients work in essential jobs, the Supreme Court is considering whether to approve the administration's cruel rollback of that program. These actions are unconscionable and will hurt the American people. Whether it's reporting to work in hospitals, restaurants, or nursing homes, immigrants are keeping Americans alive and fed during this crisis. And I'm proud to join my colleagues today in highlighting these important contributions. I'm joined today by two of my colleagues in the House of Representatives, Representatives Yvette Clarke from New York and Nanette Barragan from California. We are also joined by two experts who will help to shed light on the crucial role immigrants are playing in our fight against the national crisis. We have Ms. Jadot is the director of DHS Watch at America's Voice and was formerly the chief counsel at U.S. Citizenship and Immigration Services. And we have Mr. John Basilisi, who is the executive director of immigration policy at the U.S. Chamber of Commerce. Ms. Jadot and Mr. Basilisi, thank you so much for spending some time online with us in this very unorthodox forum with us to discuss these issues. And I will now recognize Representative Clarke for any opening remarks she would like to make.
Let me first of all thank you, Congresswoman Kathleen Rice, for your leadership. It's always been meaningful in non-crisis moments, but at this moment, it's taken on new resonance for the people of the United States of America. We know that immigrants are the heart and soul of our coronavirus response. They are a lifeline to communities across this nation. Millions of immigrants on the front lines of the pandemic, not only living the neighborhoods that have been hardest hit, but doing the jobs we finally recognize are essential. But as immigrant nurses are delivering healthcare to patients in need, and immigrant workers are delivering food and packages to our doors, this administration is delivering hate. Without any basis in science or fact, the, the president banned almost all immigrants for 60 days without even consulting Congress. Even as the virus rages, he continues deporting fathers, mothers, brothers, and sisters, and even threatens to sanction foreign countries that refuse to accept them, who are under current bans themselves, travel bans themselves, because of COVID-19 outbreaks. We will not stand silent. Everyone who is distressed, sick during this crisis deserves the cure. Everyone who needs assistance right now should receive it. Now is the time for us to come together and fight the common enemy of this virus. But instead, the administration continues to scapegoat the very immigrant families who are leading our response. As the daughter of immigrants myself, I won't let immigrant families be forgotten, let alone attacked at this moment of great need. With that, Madam Chair, I yield back.
Thank you so much, Representative Clarke. Now I will recognize Representative Nanette Barragan for any opening remarks she would like to make.
Thank you, Madam Chairwoman, and thank you to the committee and everybody, to the staff involved in doing this forum today. So critically important that we recognize the role of immigrants and their contributions, not just to our economy, but during this pandemic. Many of them are essential workers. My district is a heavily I'm an immigrant. My parents were immigrants. And this is a time that we all need to come together, regardless of where you were born, regardless of where you come from. This is a common threat that we have. We must all come together. Now, immigrants are playing a vital role throughout the crisis. They are meat packers, they're grocers, they're agricultural workers, transit workers, teachers, and healthcare workers on the front lines, saving lives of people that are in critical need. They are essential, and immigrants are responding and tackling this threat and standing up. And it's essential that we support them and that we provide protection so they're able to continue to do their job. Though I'm concerned about many in my district and Latino immigrants throughout this country, um, I'm hopeful that through the work of the committee and through the Congress, we're able to provide protections and policies to help protect the health and safety of all, including our immigrants. So we must stand with our immigrant communities and against division, distraction, and hate. I'm looking forward to this productive conversation on our forum and thank our guests for joining us as well. With that, I yield back.
Thank you so much, Representative Barragan. Before we go into, we're going to go right into questions because I know we all have limited time today, and we all have to start heading down to Washington. But I wanted to thank the committee, the subcommittee staff, so much for setting this up. You know, this is one of the most important things that we can do is have some continue our responsibility to have oversight over what this administration is doing, especially during a pandemic. And even though this is a new way of doing a hearing and having a conversation, I'm very grateful to the committee for setting this all up. So I'd like to ask Mr. Basilisi if you could, I think both of my colleagues gave a good rundown of the roles that immigrants play in our society now, especially as first responders and essential workers addressing the COVID-19 issue. But can you put a number and flesh out a little bit more exactly who these wonderful people are, what they're doing, what their numbers are, and what kind of health risk they're facing as well?
Well, thank you, Congresswoman Rice, for having me back to do another one of these panels again. It's nice to work with you again, Congresswoman Clarke and Congresswoman Barragan. I hope I'm pronouncing your last name correctly, as you're definitely owed that. As someone who has a very difficult to pronounce last name, I can empathize with having to deal with problems in pronunciation. To answer Congresswoman Rice's question, a lot of what you and your colleagues cited in terms of the types of workers that are here in the U.S., where you see an overrepresentation of immigrant workers in certain fields. Clearly, that includes agricultural production, food production. It also includes, you see a lot of medical doctors, a lot of biomedical scientists, nurses. A lot of those fields are clearly, have a substantial amount of immigrant workers in them. One field that wasn't talked about, but I think is still very important, at least in this time, is if you look at the cleaning industry. So not just like residential cleaners, but also commercial cleaners that deal with offices that are still open, making sure that for people that still have to go to a workplace, it is clean. You see a lot of maids, a lot of commercial cleaners. There's a substantial amount of immigrant workers that are out there making sure that for other folks that are, think of your grocery stores. Who's cleaning them at night? And that's a good pivot to also the grocery stores. Who's stocking the shelves? Also, a substantial amount of immigrants in those fields as well. I, unlike my sister and my father, did not get into a medical profession. I went to law school, so I can't speak to the the scientific medical risks that these folks face when they go to the workplace. But clearly, we wouldn't have all of these stay-at-home orders and the economy being shut down the way that it was if it wasn't a serious threat. So clearly, these people are putting themselves at risk when they go to work to make sure that our country that we all love and call home can make it through this tough time.
Yeah. Um, if I could just direct a question to Ms. Jadot, you know, my governor every day, Yvette and my governor in New York here, Governor Cuomo, has been laying out all week because we have a stay-at-home, shelter-in-place order that goes through May 15th throughout the state, and he's been laying out what steps localities, cities, towns have to take in order to safely reopen. I just ask you, Ms. Jadot, what steps should I think it's the horse has left the barn, is that the saying, in terms of there being a national response to how to address this, whether it's testing, contact tracing, isolation, or how to shut down and reopen, our economy state by state. But what steps, as states like New York begin to reopen, what steps should the federal government take or state governments take in order to assure that the safety concerns that immigrant workers are facing are addressed by their employers?
So there are many things that can and should be done. And I should note, immigrant essential workers, like all essential workers, are seeking access to the personal protective gear they may need in coming into contact with other people in their workplace or with clients, with customers. They're seeking COVID testing, available COVID testing, and free of charge. They're seeking covered health care, health insurance. They need paid sick leave in case they get sick while on the job. Those are some pretty basic things that most of us need in order to take the risks, get outside our homes, and get back to work. That's for anybody who's going back to work, particularly for folks who have either a legal immigration temporary status or for those who are undocumented. Because despite of their essential work, many of them don't have access to health insurance. Many of them don't have access to paid sick leave. Many of them don't have access to personal protective gear. And an example, in the last CARES Act, they didn't get access, even though they're tax paying, they didn't get access to those stimulus checks, even US citizens who are living in a mixed status household. So things like that could be done to ensure that as people get back to work, and even for those essential workers who have been working through that, that's important. But that's the protection on that everybody needs. But with regard to immigrants specifically, there are some additional things that we could do for the documented and the undocumented essential workers. For those that are documented, we want to make sure that they don't fall out of status. USCIS offices are closed. There's a lot of support that people need to submit renewals, and all of those things are limited at this time. So we need to ease and be flexible so that people who are documented can continue to remain documented. And then for those who are undocumented and vulnerable to a potential arrest, a stop on the way to their essential work, we want to make sure that is not happening. And we want to make sure that they're being given a way to come and step forward so they don't have to fear continuing as they go to their work, and for all of us to put food on the table, to be delivery workers, to stock our shelves with the meat that's being packed by immigrant workers. So things like that need to be done, and it's not difficult. Some of the I can point to some very clear things that could be done right away. We could reinstate DACA and TP that this administration, pretty early in the administration. We could automatically extend immigration status and associated work permits for people who do have status. And perhaps ICE could step forward and announce that they won't be enforcing the law against people doing essential work for us, or better yet, providing work permits, even if temporarily.
Those are really great suggestions, and I would like to. I think a lot of them are covered in the bill that we're going to be voting on Friday. That the text of which was just released yesterday. So we'll see how. I think we feel pretty confident that that's going to pass. But I'd like to see if my fellow New Yorker, Congresswoman Clarke would like to ask a question.
Thank you, Chair. For uh, filling jobs, many of which put them at high risk for contracting the virus. At the same time, many immigrants are, in particular, in light of the recent Supreme Court decision not to suspend the rule, many families are fearful that getting the financial assistance they need now could have serious immigration consequences later. Could you discuss the public charge rule in the context of this
Sure.
pandemic?
You know, there are some steps this administration has taken, but they are woefully inadequate. One of them was to announce that that with regard to COVID testing and treatment, that use of benefits would not apply to a public charge analysis under their new regulation. But why is that so woefully inadequate? They didn't even advertise it. It was done by tweet. It's not even on their landing page with regard to COVID on their website, where they have, this is what we're doing to assist during the COVID crisis. And what we really need is to have a complete suspension of the public charge rule. At this moment, it's confusing. How do people know exactly what is COVID treatment? What if you have a related symptom that is not necessarily COVID and you need to get treatment for that? What does it mean? We do not understand yet the full effects of what COVID is doing to our bodies. We're learning more and more every day about the symptoms and the sicknesses, the things, the effects of it. And we have no idea where this is taking us. So for the moment, we should not be putting this barrier in place for immigrants who are seeking to make themselves legal and go the route that everybody talks about, follow the rules, and make it so confusing and so scary. This could only hurt our public health. That will hurt not only the individual, but the entire country.
Just as a follow-up, on March 30th on March 20th, Chairman Thompson and I wrote to the Department of Justice and the Executive Office of Immigration, urged them to close all immigration for hearings for unaccompanied minors. Thousands of children in government custody who cross the border without an adult have, in many cases, continued. How does this make sense in the middle of a once-in-a-century pandemic? And how can we be sure the due process rights of these children
you're exactly
aren't
right.
being violated?
You know, on the one hand, when it comes to where the pandemic is having a serious effect on people needing access to services and people needing flexibility with regard to their immigration status, the administration has been very slow and in some ways has not reacted. And instead, what they're doing is they're using this pandemic as the pretext for anything to continue the deportation orders that come out of the immigration courts. They've issued the proclamation that closed green cards for US citizen family members and for immigrants coming from underrepresented countries. They've used this arcane Public Health Service Act, really, 70 years old at least, actually much further than that, to justify their closing of asylum at the southern border. So when it comes to try to assisting, they say, oh, no, this is too difficult. There might be legal issues here. There might be operational concerns. But when it comes to keeping people out, deporting people, they have not been shy to step forward.
Thank you. To both witnesses, in April, Donald Trump tweeted, "I'll be signing an executive order to temporarily suspend immigration into the United States." Since then, he released a 60-day ban on most immigration, keeping families separated and essential workers out. Mr. Basilisi, could the economic implications of this executive order?
Yeah, Yes, of course. As you can imagine, I was not exactly enthusiastic when this tweet came out late on a Monday night, and my inbox went a flurry with all sorts of requests from companies saying, "What's going to happen to our workers? What's going to happen to our workers?" Um, you know, the fact that this EO only impacts immigrant visa holders um, it allowed for some folks to have a sigh of relief because they knew that the non-immigrant visa workers that they needed to bring in cases where I can talk about a few companies. Some folks were trying to bring medical researchers in to do critical pulmonary research, which, when you're dealing with COVID-19 and it has a drastically negative impact on your lung function, having folks do this type of research is the type of folks that you want to have come into the country. Ensuring that those folks still get in, that was one of those things where, okay, it's bad that we can't get new immigrant workers that we want to come in. There's no downplaying the significance of that. It's bad. But on the other hand, knowing that there's another way for other folks that are just as critical and just as essential for them to come in, there was a sigh of relief. But when the actual order came out, I believe it was that Wednesday afternoon, and everyone's reading it, and there's a review process on all non-immigrant visa programs. And the White House is going to be working with the Labor Department and Department of Homeland Security, and the State Department is going to be working in a consultative role to talk about what types of non-immigrant visa programs they want to either, ban outright or institute new restrictions upon. That caused an awful lot of concern in the sense that, all right, we live to fight another day, but there's more bad news that's probably coming down the pipe. And the concern we have at the chamber is that this is something that, it's not just a matter of the near-term economic impact, although that's bad. I'm not saying it's bad, but long-term, if you actually want to have a recovery, you need to ensure that companies have the ability to hire the workers that they need to hire. And for intercompany transferees, they need to be able to move folks from one location outside the U.S. to another location inside the U.S. And that includes not just the folks that do medical research and other essential workers that come in to work at all sorts of medical device manufacturers and things like that, and other pharmaceutical companies. But there's also like the issue of just think of other IT services workers, folks that are in the IT industry. Pray tell, who is doing the data analytics on all of the medical research that's being done? It's not the actual pharmaceutical research companies that are doing this. They're, enter into contracts with IT services firms and folks that can do this type of service. So we know as soon as possible, is this treatment effective? Is this vaccine or is this potential vaccine going to work? Those things are crucial to our recovery, not just in terms of making sure we can stop the spread of COVID, but it's that type of assurance you need in the medical community to know, all right, people can go outside again and not worry about getting COVID. So it's critical that any actions that the administration does in the future, it needs to at least take into effect that, you're not just talking about one immigrant program or this, that, or what the other. You're talking about something that's much bigger. It's going to have a much larger, profound impact on our economy.
Thank you very much. Madam Chair, I yield back.
Thank you. I'd like to ask my colleague from California, Nanette Barragan, if she has any questions.
Absolutely. Thank you for all these great suggestions and points. A recent Center for American Progress study found that there's more than 200,000 DACA recipients currently working on the front lines of the crisis. These are individuals that are protecting the safety and health of American citizens, even as the Supreme Court considers the Trump administration's rollback of the DACA program. Ms. Jadot or Mr. Basilisi, how critical is it to the nation's response and recovery from COVID-19 to maintain protections in place for DACA recipients who are on the front lines, and maybe shed some light on what would happen? What would happen if there was an immediate rollback and we lost all of these essential workers into these essential areas, including the healthcare space.
So I'm happy to start, and John, if you want to step in. So there are, of those 200,000 essential workers, there are 29,000 of them that are in healthcare. At a time when the state of New York was sending texts to healthcare workers all around the country that they had connections to, asking them to volunteer and come to New York to help them, how is it possible that we could take the legal status of one healthcare worker away? And we're talking about 29,000 of them. There are also several thousand other TPS healthcare workers who are in a similar boat, not the exact same boat, but very similar. Their programs were also ended. This is clearly not the time to be ending statuses of people who are contributing and putting their lives at risk literally every day in hospitals around the country helping us. And I just want to know, I can't imagine what it's like every day that there's a Supreme Court decision day, and tomorrow is another one. The potential possibility we're all sitting on pins and needles, and your life could be upended completely by a decision by the Supreme Court. But I would note, it is not the Supreme Court who started this. This was the administration, clearly by choice, terminating a program that was operating well for 4 to 5 years, 700,000 people protected, contributing to our society. And to end it now doesn't make any sense to me. And it is very easy for them at this moment to simply reinstate the program and submit a motion to the Supreme Court, step out of the case. That's as simple as that. And they can do the same thing with TPS.
Thank you.
Or there's one thing that I could add to your comments. Like, to me, like, it's a personal issue because my cousin is a nurse at Maimonides Medical Center in Brooklyn. So when you're talking about having the status or the work authorization of these nurses in flux, you're talking about, and I'm not asking my cousin, do you know the status of your colleagues, but some of them are immigrants. I don't know if they're DACA recipients, but if these people are helping my cousin do what she needs to do to take care of sick New Yorkers, I don't want her to be shorthanded moving forward if someone loses their status.
Right. We definitely think it would be super disruptive, not just to the country, but to the healthcare sector. If all of a sudden you start having a pool of folks that are on the front lines critically providing services. So I want to thank you all for the conversation today and recognizing the importance of our immigrants that are essential workers that are on the front lines, that are not just spurring the economy, which is headed downward, but really are on the front lines of this pandemic and helping fight it. So with that, I will yield back.
Thank you so much, Congresswoman Barragan. I just want to open up to just general conversation. Um, John, the Chamber of Commerce is a pretty influential advocacy group, right? I mean, especially amongst our Republican colleagues that the Chamber almost exclusively supports. And I just wonder, the fear, and there's been a lot of talk about how this pandemic is feeding into some of the worst instincts of this administration, which is forget the world, forget everyone else. Let's just keep everything here for us in America and forget about international allies, immigrants who want to come to this country to seek a better life. And I don't want to believe that that is going to be the outcome of this pandemic. I want to believe that all of the immigrant workers that we're talking about just add to the incredible diverse fabric of our country, and that we as Americans are going to actually embrace that as opposed to begin to mimic the incredibly divisive rhetoric coming out of this administration. So just kind of to anyone who has thought about that, because we're not out of the woods yet here, and it's going to take some time, and the economic recovery period is going to be not just 6 months, a year. It's going to be multiple years before we get back to a place of financial security, hopefully for everyone. So I would just throw that out there.
Congresswoman, I can tell you that our members and, the highest levels of chamber leadership, like we're concerned about what is coming down the pike in terms of future immigration policies. And I don't know if you've read Jason Riley's piece in the Wall Street Journal, but he sums it up pretty well using historical examples. Like you look at 1892, there was some sort of pandemic or epidemic that happened health-wise, and they passed the Quarantine Act, and you saw less immigrants coming in, and you had a recession occur. You saw during the Great Depression similar attitudes in terms of trying to keep immigrants from entering the country moving forward. I think the main lesson here is that if you want to generate economic growth, which we're going to need to in order to get out of this pickle that we're in, trying to do that with a smaller workforce has proven to be vastly suboptimal economic policy. And I hope that we don't repeat, the same misguided policies that we've done throughout our history, because all that's going to do is going to prolong the pain we're all feeling, and it's going to, ensure that the folks that are struggling the most right now are going to have a longer time horizon before they can get back to normal.
And I would agree with everything that John said. There seems to be a nostalgia for some in this administration for some things that happened in the 1920s that led us to a period of time where many of us are look back at our American history and just really are very embarrassed by it. We closed out immigration. We interned Japanese Americans, and there seems to be an interest in returning to the time when those things began. And what we need to do is take a step back and reject those viewpoints. Unfortunately, there are some people in this administration that are very close to the president and advise the president on particularly one individual, Stephen Miller, who does this and reveres some of those congressional bills that passed in 1921, 1924. So that would lead us, I think, as a country in the opposite way that we need to go. At the moment, there are 20 million essential immigrant workers. Some of them are naturalized, some of them have green cards, some of them are here in an undocumented status. We need to recognize, like we always have, they have been a part of our lives and our economy and our success as a nation. We have always had that, but it is especially clear at this moment that they form a lot of the foundation of how we're going to get out of this. We're all in it together. We're all part of it, but certainly 20 million essential immigrant workers are a part of it just as well.
Well, I couldn't agree with both of you more. And it's particularly perplexing coming from the president, who I think has, 2 out of his 3 wives were immigrants. I don't get the position.
Yeah, I wanted to circle back and ask Ms. Jadot, circle back on the executive order and ask whether there's any precedent for this order. As a former chief counsel to USCIS, do you have any concerns about the legality of the order given its rationale?
Yes, certainly. First of all, in recent history, I have not seen the use of except for the Muslim ban that we are familiar with, and also the Africa ban and the pregnancy ban. Those have all been uses of this provision in the law, and we all have, there are very strong arguments for why it is unlawful and unconstitutional. And what I want to note is what it does. It takes reserved family green cards so that US citizens and people who have green cards, lawful permanent residents, to reunite with their families inside the United States. Most of them come from abroad. And what it does, it says, we're closing those green cards down for you. If we don't use those green cards by the end of this fiscal year, it's coming very shortly, those green cards are lost. They don't roll over like rollover minutes back in the day on our cell phones. We lose them, and they end up the following year in the employment-based categories. So that's wonderful for the employment-based categories who also have a long line. Nobody should be in a long line for green cards. At the same time, there are millions and millions of family members to US citizens and lawful permanent residents who've been waiting sometimes decades. And here we are closing those out and potentially losing them for those families. And I would note that like the HEROES Act has a provision to address this. So again, I'm highly supportive of the provisions in the HEROES Act.
Let me ask one more question. Right now, most Americans are avoiding crowded spaces, including flying on airplanes. Yet as we speak, ICE is cramming immigrants approved for removal into cells and then placing them on crowded deportation flights. This is a recipe for contagion. Does this sound safe to you? What would a more sensible approach at ICE look like?
I'm happy to take that. So there are many cases in Guatemala, for example, of COVID that can be traced back to deportations from the United States, a significant number. So we are sending this pandemic to nations that haven't received it yet. Because of the insistence to continue deportations, this is not the time to do that, number one. Secondly, people in detention, at the moment, there are approximately 30,000 immigrants in detention. They don't all need to be there. And even for those who pose a flight risk, there are alternative avenues to ensuring that they are no longer flight risk, but outside of the traditional detention center where COVID really can become a hotspot in a place like a detention center where people cannot self-isolate or social distance.
Well, let me take this opportunity, Madam Chair, just to thank our panelists today. They have been profound in their statements and certainly add a perspective to this conversation that it's really important that we expose the American people to. I want to thank you for your leadership, Madam Chair, and I want to also ask that my colleague Nanette Barragan have a safe flight into Washington, D.C. And I yield back.
Thank you so much, Yvette. I'd just like to, I agree with everything that you said, and I would just like to give Ms. Jadot and Mr. Basilisi, a couple of minutes for them to, for parting comments, thoughts, whether it's about the HEROES Act that Yvette and Nanette and I are heading down to DC to vote on, or anything else that you would like to us to take away from our meeting here today.
Or I'll let you go first. Go ahead.
Sure. So we briefly touched on the fact that at the same time that the pandemic is having a serious effect on people needing access to immigration benefits and flexibility, that this administration has been shy or has not been afraid to close off those services. And yet, when it comes to the pandemic, they're using it in many ways as a pretext to continue keeping people out and deporting people. Just last night, BuzzFeed reported that the head of USCIS sent an email to staff saying that USCIS would be working with agencies to, quote, investigate attempts of immigrants seeking unlawful employment in healthcare. So just let that sink in for a moment. In the middle of a virus pandemic where healthcare workers are very much in short supply, we have the services agency, U.S. Citizenship and Immigration Services, announcing it's working to investigate immigrants working in healthcare. This is not the moment to be investigating that. This is the moment to be documenting people who are putting their lives at risk every day, walking into a hospital, cleaning those hospitals, helping us and keeping us healthy and safe.
Great point.
Congresswoman Rice, I want to thank you, Congresswoman Clarke, and Congresswoman Barragan for inviting me to be on this the opportunity to talk about these issues is important because as America is suffering, we can't lose sight of the things that make us great. And our openness and our ability to take the best from around the world, what helps make us great. The one thing that I want to at least impart upon the members here is that, you know, on the employment-based immigration side of things, you know, there's credit due to, you know, USCIS and ICE for making certain changes that are allowing companies to hire. Like, for instance, with regard to the I-9 verification process, verifying documents is something that has to be done in person. And the fact that ICE realized early on, you can't have a bunch of companies onboarding people if there's a part of this onboarding process that has to be done in person and everyone's teleworking. There has also been flexibility in terms of filing deadlines, both at USCIS and DOL, and those things are appreciated. Now, is it enough for the business community in terms of actually trying to, do everything that needs to be done to help them get through this very difficult time in terms of onboarding people and so on and so forth? No, it's not. But those things that you need to at least give credit where credit's due. However, on the big picture items, if we're talking about, not just banning certain individuals trying to enter here on immigrant visas, but also banning various folks on non-immigrant visa category, many of whom are going to be doing what, in our view and our members' views, are essential work to help us get through this tough period of time. You're going to be throwing a blanket on the recovery that needs to happen to bring everyone back to normal. And, that's the biggest issue that is overhanging the business community now, because if companies across various industries, which are all very concerned about what could possibly happen, that's a $64,000 question. I know it's an old reference to an old game show, but that's the thing that's out there that needs to be dealt with. And if, something is done that inhibits the ability of various companies to be able to meet their workforce needs going forward, it's going to have a demonstrably negative impact on the ability of our nation to recover. And I also want to thank the staff for helping bring this all together.
Well said. Well,
as a former staffer, I appreciate them.
Me too. Yes.
We all appreciate staff. Believe me, I would not have been able to put this call together if my life depended on it. That is for sure. First, I'd like to thank both Ms. Jadot and Mr. Basilisi. Thank you so much. You have given me and my colleagues a lot to think about. We appreciate your input about the next CARES bill or the HEROES Act that we're going to be voting on Friday, as well as, Mr. Basilisi, I think that, you make a good point. Credit should be given where it's due. The problem with this administration is they do it in fits and starts, and there isn't a comprehensive approach to deal with the specific situation that we're dealing with right now with this pandemic, as opposed to just their run-of-the-mill, foreign policy as it relates to immigration policy, or domestic, policy as it relates to immigration policy. So I am very grateful to your input. I want to thank so much Yvette Clarke and Nanette Barragan for coming on. I know how busy you guys are, and I'm going to be seeing you soon, well, from a distance, from a socially respectable distance, in Washington. And again, I want to thank the staff so much for putting this together. I have a feeling that this is the way things are going to be going in the future. So to be able to have this as kind of a test run really helps us a lot in terms of going forward, so that we can have the kind of oversight and hearings and input from experts in these various fields to help us as legislators. And Yvette, if you'd like to have any parting words.
I was actually putting it in the group chat, but let me then just say to everyone, this is really, really important. We're shaping a civil society here, notwithstanding who sits in the White House at the moment. And the more that we share our observations of what has gone truly wrong, and what that means for us as we proceed through COVID-19, hopefully through this pandemic into a new reality in the 21st century, that we will have taken these lessons and learned from it in a way in which we rebuild with an understanding of what makes America America. And for generations, that has meant immigrants who have come from around the world who have added value to the development of our civil society. And I don't see current day immigrants as doing anything less than those who have preceded them. So thank you very much.
I agree with everything you said, Yvette, and thank you again so much. And thank our guests and the staff, and everyone be safe, wash your hands, and hopefully we will see you all soon, sometime in person soon.
Thank you. Thank
Thank
you for
you.
including me.